Almost the entire Singapore economy could reopen before the end of June. Restrictions will be relaxed on social interactions only if transmission rates remain low. The decision whether to move to phase 2 in a staggered roadmap will be made by the middle of the month, 2 weeks after the country reopens on Tuesday. The multi-ministry task force also says the discharge criteria for COVID-19 patients has been revised. All patients assessed to be well on day 21 can be discharged without further screening despite testing positive. Tan Si-hui joins us now live. So Si-hui, the authorities mentioned the possibility of moving to phase 2 by mid-June. Tell us more about that.
So now with phase 1 happening on June 2nd, the authorities are expecting 75% of the economy to resume operations. And if the community infection rate remains low and stable over the following 2 weeks, the authorities will decide by the middle of June whether or not to proceed with phase 2. That means we could see phase 2 happening even before the end of June. Now, the task force had previously said that phase 2 would begin 4 to 6 weeks after the circuit breaker ends. And this is what we can expect in phase 2. The reopening of retail shops and consumer services, dining in at F&B outlets, of course, subjected to a cap of up to 5 people at each table. Now, this also applies to social interactions and family visits. But there will be a more cautious approach for higher risk settings like venues with large gatherings of people or those in close contact. Now, these include enclosed museums, libraries, theatres, religious functions, bars, pubs, and clubs. That's because there have been instances of cases of transmissions in such settings overseas. There will be ongoing discussions with businesses and organizations on safeguard measures as well as the precise timing to resume activities in phase 2. Now, as for outbound travel in phase 2, there's also continuing conversations on reopening borders and establishing travel bubbles with countries. This would mean clear protocols in place, including testing of travelers from one country to another, even ensuring contact tracing of travelers while they are in Singapore. This is to give assurance that travelers are free from virus and essential travel can resume for workers. Now, conversations and discussion with countries are ongoing, and more details will be announced on any particular country when the authorities have reached an agreement.
We thought it would be useful to share with Singaporeans to give everyone a clearer sense of what to expect over the coming weeks, both in terms of the reopening, phase 1, and then subsequently to phase 2 before the end of June, possibly, as I said, depending on the situation and the assessment of our community transmission in the first 2 weeks of June. And also, we are working on easing of travel restrictions and resuming of travel with specific countries. As we do all of these things, we can expect activity level to rise, and therefore, I want to reiterate what Minister Gan said just now. It is even more important for everyone to take responsibility of their actions, because with more activities, the likelihood of transmission rises, and we have to be prepared that there will be more cases.
Mr. Lawrence Wong also warned that there's a possibility that phase 2 may not actually happen in June and could only happen in July should the situation worsen.
Right, and Si-hui, help us understand this as well. Why are the authorities revising the discharge criteria?
That's because they're looking at data findings and research. So according to findings of a study by the National Center for Infectious Diseases, COVID-19 patients are no longer infectious after 11 days. Now, the World Health Organization also recommended that patients can be discharged after 10 days from the onset of infection and within 3 days without respiratory symptoms or fever. The authorities here studied this data closely and are taking actually a more cautious approach by only discharging patients by day 21. And these patients are only allowed to go back into the community after another 7 days. That means day 28. So the authorities also wanted to free up capacity to divert to other testing priorities, such as diagnosing migrant workers and immediately clear patients who have recovered. Now, the Director of Medical Services at the Health Ministry, he illustrated this point with the preschool sector. That's where 33,100 tests were carried out for staff members. Now, 11 out of 12 of those who tested positive are those who have previously recovered and are not infectious. That means they can go back to work. But the remaining staff member, the test is still pending.
All right, thanks, Su Hui, for that update. There are no new COVID-19 infections reported among Singaporeans or permanent residents today. That's a first in more than 3 months. 373 new cases have been recorded, taking the national total past 33,200. The Health Ministry says the vast majority are migrant workers staying in dormitories.